The South Florida Business Report.
Coming up next, Business Report producer David Weir talks with one of the top plastic surgeons in South Florida, Dr. Rafael Cabrera. Dave asked the veteran Boca Raton physician how he handles patients who ask to look younger.
Well, I guess that's the holy grail for everyone, to look younger. But I think when people consider what they're really asking, they don't necessarily want to look younger. I think people appreciate the age that they are, and they're happy to have lived the years. I don't think anybody would go back to puberty.
No, of course not, yeah.
What they really mean is that they want to look better, and they want to look contemporarily vital. They don't want to be tired appearing, having saggy skin that people mistake for either a lack of vitality or tiredness.
Right. You know, a lot of times, you know, that you go to the plastic surgeon and they say, okay, do this, it'll change my life. Well, that really doesn't happen, does it? How do you approach that?
I think you're 100% right. Plastic surgery or any cosmetic intervention, whether it's invasive or non-invasive, doesn't change a life. And if you have a patient who is putting all of their emotional eggs in that basket, as a surgeon or a practitioner, you have an obligation to identify that before you do the procedure and explain to them that that will not occur.
You know, looking at your biography, you know, you are absolutely terrific when it comes to credentials here. You were a graduate of Cornell, and then what happened? And then where did you go?
Well, after Cornell, I really had the opportunity to go anywhere in the country, and I was fortunate enough to be from New York and knew the reputation of Bellevue Hospital and NYU Medical Center, and knew that in my particular line of work in surgery, that there was no better training.
Do you do, you know, we had this Botox scare when this idiot chiropractor almost killed 2 people down in Fort Lauderdale with Botox. Do you use Botox a lot when in your practice?
Yes, I do. I think Botox is a great tool, but what people need to recognize that a tool is only as good as the operator behind it. And that's true for Botox, it's true for any kind of surgery that you're doing. So if you look at what happened a few years back, unfortunately, based on the facts of the case, it probably would have been predictable had people known what was going on. So it's incumbent on the patient to make sure that their practitioner is following the proper guidelines of safety and the regulations that are put forth by the Board of Medicine.
All right. Listen, Doc, you're in a demographic. Now, you got people my age, if you're coming in, you got the neck thing right here. So can you take the neck off and all this type of stuff?
My standard line is that I only have 2 hands. I'm not sure what I could do for you. No, but the truth is that, you know, there are a million ways to do things. And it's not so much learning how to do one procedure or applying one procedure to everyone. The key is to have the trust in your practitioner to be able to identify the salient features of your particular problem and apply the known techniques to that problem. So, as an example, in a gentleman who in an older age group that has just a problem with their neck.
Yeah, that's me.
There's something that is very directly approachable that carries very little risk and very little time away from work, where it's just a direct neck lift, where we literally remove that stuff.
You're getting involved with some of the latest stuff, like non-invasive plastic surgery. What's that all about?
Well, in the last, I'd say 15 years or so, with the advent of Botox as the forerunner and the great injectables that we now have, and some of the light-based therapies and some of the fractional lasers, there's lots of things that we can impact in a non-invasive fashion where there's very little downtime or recovery that makes a positive effect on a patient. However, having said that, what people need to remember, it's a lot like exercise. What you get out is what you put into it. And at the end of the day, the non-invasives are generally best suited for people who are not ready for cosmetic surgery or people who've had cosmetic surgery that need the icing on the cake.
With the injectables, with collagen, with the females, this has become a kind of like a rage to put the collagen in the lips to make the lips sexy and rocking and rolling and all that. But sometimes they overdo it and they kind of look like a guppy, a fish, you know, running around.
Well, I'll tell you, it's sort of like a mini skirt. You know, I like mini skirts, but not on everybody. You know, so I think that you should know yourself, number one, and you should have an idea of what looks good on you. But really, at the end of the day, you expect your practitioner to have that artistic and scientific ability to determine what's going to look right on you.
Well, is stuff like that, is that reversible, or have they had it? Well,
that's a great question. I think that one of the decisions you need to make is which product is right for you, and it's a decision that should not be made based on advertising.
Right.
So, for instance, in my office, I carry every injectable because I find that each one suits itself to a specific circumstance. There are some injectables that are short-lived, and there are others that last longer. And then there are others that are semi-permanent, which means last more than 2 years, maybe up to 5. And then there are others that are clearly permanent, something like silicone, which is not FDA approved for the use of injection in the face. So I personally steer away from those things that are not FDA approved.
Sure.
In fact, I don't even look at them. And I make sure that patients understand the ramifications of having the injection.
What is the cost of, the average cost, we'll say, of a facelift? How much again?
Well, as you know, it's like cars. You can buy a Hyundai, or you can buy a Mercedes, or you can buy it with a sunroof, or you can buy it without. But I think that, you know, there's so many different things that are called facelifts nowadays that people have to be very astute and pay attention to actually what's getting done. But the average price really is anywhere between $5,000 and I'd say $15,000.
How much is a breast augmentation?
Well, it depends. How many breasts do you want? And I often joke with people when they want a discount. I say, buy 2, get 1 free. No, the average breast augmentation, again, is going to be around $5,000.
I got you. So we got to go. Thanks for being here.
Thank you. It's a pleasure.
And stay with us. We'll return right after these words.